matter how much you read about it or hear about it, nothing can prepare you for the incredible change in your life that a new baby brings.
Before returning home with your newborn, every mother and her baby must meet criteria for discharge.
This video will provide you with helpful information for you and your baby during the first few weeks at home.
Let's begin. Following the video, additional contact information will be made available.
Infant well-being.
There is a direct relationship between baby's intake and their output. It is important to monitor their wet or dry diapers. How do I know if my baby's diaper is wet enough? You can tell by the increased weight of the diaper. You may be able to smell the odor of urine. If you are not satisfied the diaper is indeed wet, you may pull the diaper apart to be sure. The absorbent material is fluffy when dry and crystallized when wet. You may also put a tissue next to the baby. It will get wet and stay wet, whereas diapers absorb all moisture. Your baby should have at least one black or brown stool within the first 24 hours. If this has not occurred, please contact your healthcare provider.
Baby's feeding record.
While in hospital, you have been keeping track of your baby's feeds. When you go home, continue to write this information down and complete the feeding record on the baby's ticket to health supplied in your discharge package. This will help your healthcare provider understand your baby's feeding. You need to bring this record with you and the baby to each healthcare appointment you have in the first couple of weeks.
Signs and symptoms of dehydration.
It is very important that you recognize the signs and symptoms that your baby is not getting enough to drink. This is called dehydration. There will be a decreased number of wet diapers. Your baby will become more sleepy and hard to wake up for feeds. You may notice that your baby sleeps more than 4 to 5 hours more than once per day. The baby may have a dry tongue, mouth, and lips. If you are concerned that one or more of these signs are apparent in your child, please contact your healthcare provider. If you are not able to receive prompt assistance, go to the emergency department immediately.
Jaundice.
Jaundice is a condition where the baby's skin or white parts of the baby's eye becomes yellow in color. This is caused by high levels of bilirubin in a baby's blood. What is bilirubin? When babies are born, they have extra red blood cells. These extra red blood cells are broken down and removed from the baby's body in urine and stool. The breakdown of these red blood cells releases bilirubin into the baby's body. Feeding a baby more often will help increase voiding and stooling, thus removing excess bilirubin from the body. Jaundice babies tend to be sleepy and need encouragement to feed. To do this, you can remove the baby's clothing, put the baby skin to skin, then putting the baby in the crib or cot after holding skin to skin will often wake the baby up. You can also try rubbing your baby's feet, back, and head. If the bilirubin level is elevated above normal, your baby may require repeat blood work and/or treatment. This treatment is called phototherapy, a painless, non-invasive treatment. This treatment is provided in the hospital. If you have further questions, you can refer to your handout on newborn jaundice and your baby included in your discharge package.
Newborn screening.
Newborn screening is a recommended blood test done on all babies with parents' consent between 24 hours of age and 4 days. Refer to the pamphlet in your discharge teaching package for more information on this testing. If you go home before the baby is 24 hours of age, the test will be done when you return for your post-birth clinic appointment. If you are not returning to the post-birth clinic, your nurse will give you instructions for returning to our hospital lab within 4 days of your baby's birth to have the test done.
Hearing screening test.
With parents' consent, we screen each newborn's hearing after 12 hours of age. Refer to the pamphlet in your discharge teaching package. If the baby is discharged less than 12 hours after birth, the screening test will be completed when you return to your post-birth clinic appointment. If your baby obtains or refer results on the hospital screening test, it is usually caused by fluid in the ear canal. This fluid is from being in the uterus and it is normal. You will be contacted for follow-up in the community by the Erin Oak Hearing Center.
Safety concerns.
As a parent, it is your responsibility to research all products that come into contact with your baby. You are required by law to have an approved rear-facing infant car seat if you are traveling with your baby in a private vehicle. It is your responsibility to be familiar with its operation before you leave the hospital with your baby. This is part of the criteria for your baby's discharge. For more information, go to the Transport Canada website. Bassinets and cribs come in all sorts of shapes and sizes. It is important to choose approved equipment that is functional, easy to clean, and meets current Ontario safety regulations. If you are able to afford new products, research and compare products prior to purchase. If you will be using equipment that is second-hand or donated, please ensure all safety features meet Canadian government standards. You can find information on crib safety at the Canadian Pediatric website.
Cord care.
When you are ready to leave the hospital with your baby, you may notice that the cord clamp is still attached to the cord. This is normal. Do not attempt to remove the cord or the clamp forcibly. They will naturally fall off in several days. The cord will turn black and exude a faint odor prior to falling off. If you notice redness or foul discharge at the base of the cord, your baby needs to be seen by its primary health care provider.
Plagiocephaly. Flathead.
When your baby is placed on its back to sleep, make sure to have the baby alternate facing right or left to avoid developing a flat area on the back of the head. Your baby should be placed on his or her tummy for tummy time to promote development and to prevent flat spots on the head. When your baby is awake and supervised, this is a good opportunity to build strength and motor skills. Please refer to the information sheet in the discharge information package.
Sudden infant death syndrome. SIDS.
Sudden infant death syndrome, also called SIDS and often referred to as crib death, refers to a sudden and unexpected death of an apparently healthy infant less than 1 year of age. There are things you can do to reduce the risk of SIDS. We know that placing baby to sleep on his or her back reduces the risk of SIDS. Once your baby is able to roll over and move on their own, they will naturally assume their own sleeping position. Avoid keeping any soft articles in their cribs, such as soft mattresses, fluffy pillows, comforters, stuffed toys, bumper pads, or plastic packaging of any size. It is known that providing a smoke and drug-free environment before and after birth will reduce the risk of SIDS. Avoid all use of narcotics, alcohol, and smoking. Caring for a baby or bed sharing while under the influence of narcotics or alcohol increases the risk of SIDS. These products alter your ability to respond appropriately to your baby's needs. It is important to appropriately dress your baby for sleep. Keep your baby warm, not hot. Gauge his or her comfort level by your own. If the room temperature is right for you, it is right for the baby. This strategy may offer protection from SIDS. It is important to understand that until the cause or causes of SIDS are identified, research and prevention can only reduce the risk. It is recommended that your baby share your room on a safe surface, not your bed. Please refer to the pamphlet in your teaching package. For more information on safe sleeping, refer to the Canadian Pediatric Society website.
Shaken baby syndrome.
The first days of being a parent can be overwhelming. Increased stress of caring for your baby combined with lack of sleep can escalate to a point where shaking your baby to stop crying might seem rational. Never shake your baby. Put baby in a safe place walk away, calm yourself, take a break, and call a friend or family member. The baby's brain is very fragile, and any shaking movement could cause swelling in the brain or harm the spinal cord. This action could lead to long-term damage or death. It is best to seek professional help if you are having a difficult time adjusting to the challenges of parenthood. Please be advised that all information presented in this video is provided for informational purposes only.
This video does not provide medical advice. If you have or suspect you have a health problem, please consult your healthcare provider. Promptly visit a hospital emergency department in your area if you suspect you or your baby is experiencing a health emergency.
Reliance on any information provided by this Grand River Hospital video is solely at your own risk.